Hi guys, it's just me today. I just want to do a very quick little story on my heart. Last May, this report was done actually June 20th, 2022. I will show you. Let's get there right now. I do want this to be a little bit quick. So the report that was done on June 20th, 2022. This is my angiogram. There's my name right here, Hayden Mark, right? So if we have a little look at my heart, we can see here the right main blood ventricle is 100% blocked. The middle is 80% blocked. Can you see that there? It's a little bit hard to see. That's 80% blocked on both sides. This side is 100% blocked and this side is 50% blocked. And over here on the right-hand side, you can see this one. It's 70% blocked. So 100 blocked, 80 blocked, 70 blocked. After the angiogram, they wanted to do a triple heart bypass surgery. So I went to my holistic garden and I grabbed out some of my favorite little plants and I gave them a go. So the result now, November 25th, 2022, Mark Hayden was seen in cardiovascular review on November 25th, 2022. Last evaluated August 9th, 2022. Since that time, from a cardiovascular perspective, he tells me he's been feeling well, which I have, denies any significant chest pains to suggest myocardial ischemia, which is true. I do not have significant heart pains, and do not describe much in the way of shortness of breath. I'm not sure what this is, and I do sleep. But and my exercise tolerance, although somewhat limited, is stable. So I don't really have the same exercise ability that I used to have. Not physically, that I'm not physically able, but don't have the space. I've lost access to my Bowflex and my treadmill and my normal space that I habitate. So it's a little different now. So the interval history has been otherwise unremarkable. No recent hospitalizations or emergency room visits. Don't forget, I'm 100% blocked, 80% blocked, and 70% blocked. As far as cardiac risk factors go, there was no history of diabetes. Blood pressure, when I went for my meeting, was acceptable. And Mark continues to use marijuana, and his cholesterol status is being treated with herbal therapies. I use herbal therapies, diet, and exercise. I really miss my diet. And I do remain on aspirin 81 milligram daily, as well as herbal medication, and I do use marijuana regularly. Don't forget, I also have a back problem. It's called congenital spondylolisthesis with in situ articulation, compounded by failed back surgery, mechanical back fusion, and spina bifida occulta. So you can see that my back or my heart is really no problem, right? Considering, and I'm doing it with plants. So on physical examination today, he was in no acute distress. Heart rate was 100 and regular. Blood pressure was 140/90. Now that is a little bit high for me, but to be honest with you, I had just smoked a couple of really fat joints on the way there in the morning in the truck. So that will probably raise my blood pressure a little bit. Head and neck examination was normal. The chest was clear. Normal first and second heart sounds. Normal first and second heart sounds. No extra sounds or murmurs. No significant peripheral edema. Basically, my heart is great. A 12 lead electrocardiogram demonstrated sinus rhythm at a rate of 100 beats per minute. He says here this is essentially a normal electrocardiogram. In summary, Mark Hayden is a 59-year-old gentleman who has established history of coronary artery disease and previous coronary intervention. I did have a stent put in at one time. That's the artery that is 100% blocked now. Mark has had some previous issues with chest pain and dyspnea and did have evidence of significant multivessel disease. See that? Did have evidence of significant multivessel disease at cardiac catheterization. He has been assessed by the doctor at Sunnybrook, and at the current time I would like to continue with his current medical management. He does not want to proceed with bypass surgery. From a cardiac perspective, he appears to be clinically stable. I appear to be clinically stable. The doctor will plan to reassess Mark in approximately 6 months' time just to see how things are progressing, but certainly would be too happy to evaluate Mark earlier should the need arise or there be any specific cardiovascular concerns. My cardiac specialist, my cardiologist, said that I have a normal EKG. I do use herbal medicine in 81 milligram. I did have an angiogram with 100% blockage on the right ventricle, 80 in the middle, and 70 on the left. Basically, I should be dead. Just throwing this out there so later on, if I find a right angel investor somewhere, maybe I'll start doing a study. Maybe, hopefully, with some doctors that have been helping Grace. That would be a dream. Thank you very much for tuning in. Hope you have a great day and enjoy.